Well, the number of cases in Australia pales in comparison to the number being reported by South Africa. The country of 57 million is seeing an average of more than 15,000 cases a day. The more contagious Delta variant and low vaccination rates are fueling the surge. A chief executive and doctor at a hospital near Johannesburg tells AFP that during this wave, patients are getting much sicker and many of them never leave hospital. Well, joining me now is Columbia University professor and the former head of South Africa's Ministerial Advisory Committee on COVID-19, Salim Abdool Karim. He chaired the committee for a year before stepping down to refocus on his research and academic commitments. And he joins us now live. And first, I got to say congratulations, because although you probably hear it all the time, you're described as the Dr. Fauci of South Africa, you actually won a joint award with Dr. Fauci for standing up for science during this pandemic.
Thank you very much, Lynda. Appreciate it. I think you've captured very well the real challenge we're facing with the Delta variant. The cases are rising rapidly, particularly in our economic heartland of Gauteng, and we anticipate it's going to now spread to our other provinces. And so we are bracing and getting ready to deal with the onslaught of cases we are expecting.
Yeah, if you could tell us a little bit more, Professor, about what South Africa is going through right now, because if I understand it right, it's currently under a 2-week, pretty strict lockdown and is facing a devastating third wave, which it looks to be higher than the previous 2 waves.
Yeah, so there's no question right now that what we are seeing in this third wave is a much faster increase in the number of cases and many more people becoming infected. It's described anecdotally, and even from some of the outbreaks I've been investigating myself, that in the previous 2 waves, we would occasionally see a member of a family and maybe 1 or 2 others. Now, when we see a member of the family, we are predicting that within a few days, we're going to see the whole family. So it's just a very much higher infectiousness that we are seeing in this particular variant, the Delta variant. The government strategy really involves around 3 things. The first is to increase vaccination. Currently, the country is vaccinating about 1% of the population each week. And now that new stocks of both the Pfizer vaccine and the Johnson & Johnson vaccine have just arrived, the plans are to increase that and probably double or even triple that over the coming weeks. The second is to impose quite substantial restrictions short of a stay-at-home order. So there's no stay-at-home order, but there's substantial restrictions in terms of curfew, non-essential travel is no longer allowed, no gatherings. So a lot of emphasis on restricting movement of people while trying to keep most businesses still going. And then the third has been, the focus on the health sector itself, preparing the healthcare services, ensuring adequate oxygen supplies, making provision for beds, and also restrictions on alcohol in order to reduce the burden that alcohol normally places on our healthcare services.
And also, I wanted to ask you about any hostility you've faced in trying to fight disinformation throughout the pandemic, because that has been an issue right around the world, especially when it comes to the rollout of vaccines.
Oh, it's a huge problem. I'm not sure whether it's that social media brings out these individuals or that's the medium that they choose, but it's really a major source of disinformation. And what I have had to face, personally in each of the waves is I've had to face this huge pressure from individuals who are promoting, instant miracle cures. In the first wave, I had to deal with hydroxychloroquine. In the second wave, I had to deal with ivermectin. And I'm not sure what's coming up next in this upcoming wave. But there seems to be just a huge push from people who want some kind of cure, and they want to know why are we not letting them have it. And then there's a lot of hostility that emanates from that.
Yeah, I mean, it certainly probably didn't help that last year at the height of the pandemic here in the United States, we had a president who was also pushing some of those conspiracy theories. And no doubt the rest of the world was listening. We also continue to have a problem with vaccine hesitancy here. Is it an issue there, or is it more that you just haven't had the supply in South Africa of vaccines?
So right now, there's just queues of people wanting to be vaccinated. So vaccine hesitancy is not an issue for us at this time. But there have been 3 studies that have been undertaken. The largest of them gave us a pretty good idea about where we stand. Roughly about 12% of South Africa's population are quite vociferously anti-vaccine. Many of them don't even vaccinate their children. And a lot of them are involved in social media groups and so on that promote anti-vaccine. They believe that the vaccines contain microchips and all kinds of things. But there's a big group of around 17 to 18% that are just hesitant. They're just not sure. They are concerned about the safety, that maybe the vaccines will fast track. They need to be convinced. And then about 71% of the population are keen, want the vaccine. So overall, if we can just get that 71% to get their vaccines, we'll make a big difference. And then we'll focus. And right now there's already a campaign underway to provide information to address some of the concerns around safety and whether there were any shortcuts taken in approving vaccines in South Africa.
And of course, Professor, there is a COVAX program to help facilitate the distribution of vaccines amongst some of the poorer countries. What needs to happen, in your view, to ensure that that's a success?
I think it's been just unconscionable to look at the current situation where something like 7 countries have consumed can you hear me? Yeah.
Yes.
Have consumed about 75% of all the vaccines. I think there's just no scenario in this world where one country or a handful of countries can achieve high vaccination coverage while the virus is spreading rampantly in the rest of the world. That scenario there's no end game that sees that kind of scenario winning. The only way to deal with a pandemic is to ensure that we are vaccinating the whole world at similar levels so that we are suppressing the virus in a very systematic way globally. And so right now, the situation in Africa is that we have about 1/10 the vaccine coverage that is present in the rest of the world. So we've really got to do better. And the big problem has been not that we don't have the infrastructure. The problem has been we can't get hold of doses. And that the big countries, the wealthier countries, were able to buy up most of the doses. And so COVAX joined the end of the queue. And so COVAX doesn't have vaccines, and COVAX depended on India, on the Serum Institute of India supplying them. And that, provider was turned off because of the needs in India. So Africa has taken a huge hit in terms of a lack of doses. And we desperately, because we're facing this 3rd wave, need something like about 250 million doses just to try and get our populations up to about 20% coverage.
Wow. Incredible statistics there. And I mean, as we continue to say on the program here, no country in a pandemic is safe unless all countries are safe. Professor Salim Abdool Karim, really appreciate your time today. Thanks so much.
Absolute pleasure. Thank you.
So could climate change have played a part in the collapse of the condominium in Florida? Coming up, we're going to ask an expert on the subject to give us his take on what may have happened. Stay with us.